Have you been struggling with migraines or daily headaches? And the only thing that helps you out is taking some medication at the end of the day, only to wake up the next day with a migraine again. And anytime you go to the doctor, you get asked the same questions. Have you been sleeping properly? Have you been under a lot of stress lately? Did you forget to drink caffeine? Or did you skip any meals? Or have you been working out way too much? Which your answer to these are pretty much the same, that you've been getting the good amount of sleep, you haven't been under that much stress, you don't drink caffeine or have stayed consistent with it, you don't skip meals and eat quite healthy, or you do not overexert yourself. Which leads to the question, why are you struggling with migraines still if you're doing all other things right? See, what we find in our office is that a common trigger to migraines or daily headaches is a misalignment in the upper cervical spine. See, when you have been in some type of traumatic experience, whether that's a car crash, whether that's a sports injury, a big fall, or just repetitive use over time in your daily job, what can happen is you can cause your upper cervical spine to misalign and get stuck underneath the skull. When that happens, there's multiple mechanisms in your body that could get affected that can trigger migraines. For example, number one, blood flow through your vertebral artery getting pressure due to the misalignment. Two, pressure in your head can actually change due to CSF flow, cerebral spinal fluid. Not being able to move and drain out can create migraines, and that pressure that is everywhere. And lastly, muscle tone. When your upper cervical spine, your atlas shifts out of position, you can get some pressure or pain on the base of the skull that sometimes travel up, appearing like if it were a migraine. And if this sounds like you and you've been struggling with migraines and don't know where it's coming from, you might have an upper cervical misalignment causing your migraines. So let's make sure that you get checked. Let's make sure that your body's in alignment so that it can function properly and allow you to live migraine free.